Hey everybody, we're back. Brand new Cabral HouseCall. This is episode 3026. If you'd like to follow along with all of today's Cabral HouseCall questions from the community, head on over to stephencabral.com/3026. All right, let's dive right into the show. Always answering all things wellness, weight loss, weight gain, anti-aging, high performance health, you name it, we're here to help. So Annie's writing in, and Annie's question is, for the last 3 years, I've had consistent mucus in my throat. Sometimes it gets worse after eating fat like avocado and nut butter. The mucus is always clear if I spit it out. I thought it was acid reflux, but I'm not sure why it would be affected by fats. Thank you for your help in advance. Okay, so this can be many things. Honestly, it can be many things, but I'm going to give you some different places to start. And of course, I have to share with you, I can't give you any medical diagnosis, medical cures, medical treatment plans, or medical advice of any type. But we'll get into some natural health. We'll help look for the underlying root causes, which in my opinion are the only way to get well, is to find the underlying root cause and not to systematically palliate the symptoms. All right, so when I look at avocados and I look at nut butter, right away I'm thinking, oh, well, there could be potentially be a sensitivity to a certain histamine-containing food. So that is something at least to be aware of. You may create more mucus like I used to do back in the day because I had a histamine-based over-exaggeration called mastocytosis or mast cell activation syndrome. I had to fix my gut, which ultimately is what fixed my histamine-based issues, which is part of what's called the Th2 immune-dominant immune system. You can learn about all of those things in my book, The Rain Barrel Effect. The Rain Barrel Effect is free. It's free at stephencabral.com. You just pay the shipping, I pay the printing, or you can pay for it right on Amazon. And if you're an Amazon person, you like to get your books from Amazon, that's fine too. If you've read The Rain Barrel Effect, you haven't left a review yet, would love you to leave a review as well, of course, on Amazon. We reach more people that way. All right, so hopefully that was helpful. Let me give you a couple more though. Mucus, like if you always have consistent mucus in your throat, it could be, just make sure there's no infections in the mouth, see a good biological dentist. Another one is post-nasal drip, believe it or not, just kind of silent, they call it, sometimes post-nasal drip. There's not a lot, but it is back there. Another one could be silent acid reflux, and the acid reflux could cause that persistent mucus in the throat. My opinion, if there's a gut issue, let's find it. There's something called the big three, and that's the food sensitivity test, the candida metabolic and vitamins test, and the bacteria and parasite stool test. You can find the big three at stephencabral.com/shop, which just takes you over to EcoLife, where all of our labs and protocols are. All right, Gina's up next. Hi, Dr. Bral. I'm 33 and I survived breast cancer last year, 6 months postpartum. I had a lumpectomy, radiation, and now hormonal therapy, which has been recommended for 10 years due to my age. Should I be concerned about heavy metals in this monthly injection? Doing the 21-day detox and curious about any other pointers you have that would be helpful dealing with this long term. I've also struggled to lose weight in all of this despite a very clean diet and exercising 5 days per week. My hemoglobin A1C is now 6.2 when it was normal prior to medication. Looking for guidance on how to further manage my blood sugar. I was interested in Fatlocity, now called Metavolve, but my doctor said it has too many ingredients and advised me against taking it. Can you speak a bit about Fatlocity? Thank you. I've enrolled in IHP. Gina, so great to have you as part of IHP. And you know what? Congratulations to you on surviving breast cancer and doing everything within your power to make sure that it doesn't come back and you live a nice, long, healthy life. That's what we all want, of course, for you and for everyone. So let's work backwards. I have whole podcasts on Fatlocity, so I would prefer you just to check out those shows. But Fatlocity, now called Metavolve, is really just about boosting the metabolism. 25 cited scientifically studied studies, research. Basically, it helps with this. Helps balance healthy levels of blood sugar, hormones in terms of estrogen, sleep, cortisol, and thyroid, as well as overall circulation. So when a doctor says it has too many ingredients, that's ridiculous, right? It's so ridiculous. It's just so ridiculous. It really is. I have trouble not laughing because you go to a restaurant and there's 20 ingredients in a meal. Should you not eat the meal because there's too many ingredients? I mean, like, what are we talking about? This is absurd. When you look at what's inside of Fatlocity or MetaVolve, it's just a name, right? They're the same. We changed the name because we wanted to be more focused on metabolism and less focused on the word fat loss, which, times change. They really do. And I'm okay with that. That name was come up with in around 2005, 2006. The world was different back then. It just was. And that's okay. We can adapt and we can be sensitive to the times we're in. And I think that that's totally appropriate and totally fair. And, I've worked with enough clients now that I think that that is the right thing to do. So here's the thing though. When you look at the ingredients, you're looking at herbs, you're looking at, the best of the best. It really is. These are scientifically studied. So, I keep saying the word because I'm trying to be kind. I'm trying to be nice. I don't usually, trip up my words a little bit, but the only reason you wouldn't use this product is because it's contraindicated with any of the medications that you're using. That's basically it. And I can't give medical advice, medical treatment plans, medical cures, and medical diagnosis. So I'm having difficulty kind of helping you there. Now, what can you look at in terms of heavy metals and doing the detox? These are all things that you can do on an annual basis. So we do a 7-day detox every quarter. We do a heavy metal detox we recommend for everyone annually. You might be able to do infrared sauna. That would be great for you to do. So all of those things I recommend for you. The daily foundational protocol level 2 or 3, plus the immunity protocol every day. Now, the only reason you wouldn't do them is because it's contraindicated by your doctor. I can't give you medical advice, so I can't tell you what to do, but these are things I would look into myself personally. All right, so hopefully that's helpful. And Gina, you're going to get lots of information inside of IHP. So welcome to the community. All right, Lynette's up next. What do you know or think of the Perfect Aminos product by Dr. David Minkoff? I've heard him speak on several podcasts, and I'm just curious about Perfect Amino products. Is there validity to them? Worth trying? Just curious about your thoughts and insights. Thank you so much for your info and the knowledge you share. Thank you, Lynette, for writing in. I appreciate you. And we just answered this last week. So let's see the exact show that it was answered on. And I'm going to get that for you. And if I can't find it, then, there it is. It's episode 3019. It was asked by Alyssa. So not Lynette, but Alyssa, but she has the same question. So Lynette, head on over to stevencabral.com/3019, and it will be the very first question of the day. So even if you only want to tune into that one question, it is answered right there. All right. And then next up, let's see who's up next. Lucy's up next. Hi there. My niece, 25 years old, very healthy and body aware, has had an on and off stinging and fuzzy feeling in her mouth since August. She has had blood work done, mouth swabs, seen dentists and doctors. They all say nothing is wrong. It is her imagination. She says it is so unpleasant when it happens and needs to find a solution. Is there a podcast relating to this, please? I can't find one in the search option. Which test would you recommend? Thank you. Okay. Happy to help with this as well. Whenever a doctor says it's all in your head, which doctors said to me many, many times, it's simply because they do not have the empathy, knowledge, or education in order to be able, or perseverance in order to be able to help their patient. That's the truth. It's not fair. It's unhealthy to do to a patient. It makes them feel like something is wrong with them psychologically, and it's just not true. Patients are correct. There is something going on. And sometimes it's both psychological and physiological. I believe in this case, it's just physiological. There is something going on in her mouth. So we see stinging or hear about stinging all the time when there are elevated levels of heavy metals. All the time we see that. So definitely checking for heavy metals. And the easiest way to do that is the minerals and metals test. Super simple. The fuzzy feeling could be from yeast or bacteria. It could be from food sensitivities. The fuzziness sometimes comes because a film will begin to develop in your mouth from eating very acidic based foods. Again, I'm not getting into acid and alcohol line right now. I'm not saying that. But when for some people, you put in a pineapple, let's say, I'm not even saying it's an unhealthy food. Some people will start to either get canker sores or a fuzzy feeling over their teeth or their mouth, and it can just be from anaerobic bacteria. It could be from drinking soda. It could be from consuming too much processed sugar, and that fuzzy feeling will sometimes be there. So this can be a coating. I've talked about this too many times with a holistic dentist that they've seen this as well with this anaerobic bacteria-based buildup. So in my opinion, if you're only going to run 2 labs, it would be the starter kit, now called the vitamin tox test. You can find that at stevencabral.com/shop, or run the big 5 for a full workup and looking at all of the at-home lab tests as to what's going on with the gut, food sensitivities, and more. All right. So your niece who's 25 can also keep a food journal as to what meals it happens after, and she'll be able to start to look at correlations as well. And I definitely recommend that. All right, Robert is up next and last for today. Robert says, I did the big 5 and I have adrenal-based fatigue, very high cortisol levels. I've been fasting recently, skipping breakfast daily or doing a 24-hour with only the DNS powder. I've lost weight doing this and I've had several other benefits. Though I noticed if I don't have breakfast and I'm doing a stressful activity at work, public speaking, I shake and I feel faint. I don't get this if I have breakfast. Further, my white blood cells and neutrophils were low on a few recent blood tests. Despite getting benefits from fasting, should I not do it as often due to side effects like feeling faint, shaking, or low white blood cells and neutrophils, which I heard can be caused by stress or fasting? Would it be better if I start my fast after dinner rather than skipping breakfast? Or should I stop fast until I reduce stress levels? Thanks. All right. Well, Robert, the good news is this. I have all of this information, all free, in depth, by going to stevencabral.com/if. I'm going to go there right now just to make sure, literally, that this is where we should be. And because I haven't given the intermittent fasting shows for a little bit. Yes, this is it. Literally, this is a treasure trove on intermittent fasting. So it has everything that you could ever want on intermittent fasting. You will be an expert after going through these shows. They're about 15 minutes long. If you listen to, what would that be, 4 an hour? If you can, set aside like 1 week to listen to these shows, as many as you can. Go by whatever titles you want. You will know everything there is on intermittent fasting. I do not recommend skipping breakfast. I know you're a new listener to the show. You would have heard me say that, and that's okay. Like, totally fine. I do not recommend skipping breakfast. Never have. I know it's becoming now more popular to say, don't skip breakfast. It causes more stress in the body. It can cause a rise in cortisol levels and a dip in blood sugar followed by a subsequent spike in blood sugar. If you're an IHB, you know we've been teaching this since 2018 and in my practice for many, many years before that. And again, we're not looking for any gold stars because we didn't make this up. This is natural human physiology. So, Robert, I don't recommend skipping breakfast, but just like you said, I do recommend starting your fast earlier in the evening. So if you go from 6 at night to 8 in the morning, you're getting 14 hours of intermittent fasting. That's basically what I do. It seems to be the sweet spot for most people. You get better sleep, et cetera, et cetera. Now, if you were waking up at 4 a.m., well, you'd probably start eating sooner than 8 a.m., right? So it just depends on when you're waking up. But a lot of people waking up around 6 o'clock, 7 o'clock, and they're able to go to about 8 o'clock or so. All right, now let's answer yours. So the reason you could be fainting, and again, I have to give you my disclaimer, no medical advice, medical treatment plans, medical cures, or medical diagnosis, but it can just be the low blood sugar effects as well. When your body gets into a stressful state, is looking for glucose, it uses up a lot of what's in your bloodstream, and then it's going to start to break down liver glycogen, and if there isn't any stored liver glycogen, then it will start to break down muscle tissue as well. Okay, so at least muscle stores of glycogen. So now let's look at why the white blood cells, neutrophils. We actually had this question yesterday, and we never get questions about neutrophils. So the question I gave, or the answer I gave yesterday to the low neutrophils were viral-based infection, stress in the body, low B12, low copper, potentially low iron, low vitamin C. All different reasons that could cause anemia and stress in the body. So yeah, I mean, we could take care of basically all of these things. The daily nutritional support is going to give you the copper, the zinc. You might want to use the balanced zinc at dinner, 1 capsule at dinner, and you might want to use the activated B complex, 1 capsule at lunch, and as needed, 1 capsule at dinner. So now you get your B vitamins throughout the day. What else can I share with you? And then just make sure that there are no viral-based infections. Yeah, and I think that answers your question. So hopefully that was helpful, Robert. Appreciate you writing in. Appreciate everybody tuning into the Cabral concept. We have such an amazing community. Very much thank you. Of course, participate in that community every day at cabralsupportgroup.com. That's the free private Facebook group. Join in the conversations, chat with each other, and hopefully I get to meet you in person this year at the Reimagine Health Summit. You can just go to rhsevent.com and get your tickets. I would love to personally meet you. You can meet so many people from the community. It's going to be an amazing time. I'll talk with you then. Take care. I'll be back with tomorrow's Mindset and Motivation Monday. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.